So join me today on episode 34 of Taking Charge of My Cancer podcast. I have with us one of my physical therapy interns from University of Florida, Steven Witchoskey. He's a third-year student physical therapist from Plant City, Florida. He is currently getting his Doctor of Physical Therapy degree from the University of Florida and serves as the president of his class. Steven played Division I college football at Western Kentucky University and also served as a captain for 2 years. He's a certified strength and conditioning specialist and is currently in the process of undergoing his 4th clinical rotation for his last year of school. Steven is finished up his rotation in the oncology outpatient setting here at UF Med Plaza and will be transitioning to an inpatient oncology setting at Moffitt Center in Tampa, Florida. His passion for a role of physical therapy in athletics, and he is in the process of applying to sports resident programs. Today, he joined us to discuss his unexpected fondness for working with oncology patients and helping them to beat their cancer. So, Steven, thank you so much for doing this with me today.
Yeah, of course. Thanks for having me on.
Absolutely. So tell me about your journey a little bit. Like, why did you go into the PT role?
Yeah, for sure. Yeah, so it kind of started, I guess, back in the middle of undergrad over at Western Kentucky University. I really enjoyed the medical field. My mother actually worked in radiology for 36 years. So I felt a need to kind of help people. I liked being involved with people. I didn't want to work a job by myself. And I kind of liked what physical therapy had to offer. So then kind of turned it on around sophomore year of college to really start pursuing that, taking the right prereqs and everything. Yeah, and I've seen physical therapy myself for different athletes. I had it myself. I've had a few surgeries and had to go through it. Yeah, and it just seemed like it's something that I could use in a career where I could kind of analyze things. It made you think. You kind of had to be kind of a smarter person to be in it. You got to see a wide range of different individuals. At the end of the day, like really wanted something where I could help bring them back to doing what they love to do. Like just an everyday conversation. I love hearing about people's passions, and it can really get me excited for things. So I think seeing that, if it's an individual who just wants to get back at being the best box carrier they can, or the best CrossFitter or baseball, or just getting back to living their everyday life, I think that's a really cool field to do it in, but yeah, that's what's kind of lead me to be in physical therapy here now.
Okay, perfect. How about any 3 valuable tips that you learned through your journey?
Yeah, so for right here at the clinic that I'm at now with you.
We can do that, and then you can do as well as a journey of physical therapy. We're gonna do both. So being like as a student or as well being here in the oncology internship.
Okay, yeah. So I guess first kind of starting out as a student, with the 3 years here now, like you just see anything and everything. University of Florida, especially, they give you a whole wide range of opportunity to kind of see what you want to see things that maybe not used to, especially, in the neuro field and the orthopedic field. You have a lot of options here too, but I guess my biggest tip is just kind of take advantage of that. And we'll talk about this later, I guess, once we talk about, my time here in the clinic, but being able to reach out to the resources you have around you. If you have a certain interest, these PT programs really want to help you pursue that. If you have a passion, then go pursue it. That's been kind of like a fun thing to do here, especially like, I have an interest right now in the sports field, and I've been able to work with Florida football here, women's basketball, gymnastics. So I think it's important to kind of use the people around you to guide you into a better direction. And, once those doors open, you have really, really cool opportunities. So something cool.
Perfect. How about from the oncology standpoint? Like you came here with, I know your mind is going into sports medicine, and then you come here to do an oncology internship with me, which, we're going towards the end this week for like, nice, fun 8 weeks. But what will be your 3 more valuable things that you will give for our audience regarding their cancer journey?
Yeah, no, it's been definitely a whirlwind here. You've helped guide me. It was kind of crazy jumping into it. I had a few expectations, and those were kind of set aside after the first week. I thought at first I'd be working with a lot of lymphedema, which for those of you who don't know, it's kind of like a swelling of the arm that can happen after a breast cancer surgery. And I thought that was the only thing we'd be focusing on, because I didn't really see much other problems arising after a breast cancer surgery. But now being here and being somewhat established after 2 months, it's unbelievable the differentiation you have between patients. You can have, we talked about this morning, Durley, with, you can have 3 or 4 patients all with the same diagnosis. They all had breast cancer. They all went through the same surgery. And then whenever they come out, it's widely different treatment options. Some of them may be really restricted in range of motion. Some may be lacking the strength. And you go into the fields of, what kind of surgery did they have? Are they at a risk for lymphedema? And at the end of the day, we want to get them back to doing what they love to do. That's the first couple questions we ask them when they come in for their pre-op visit. So it's been just unbelievable kind of learning about the journey of these people. Number one, kind of being an open book towards that. And then number two, it's been really interesting. I think it's probably the top thing I'll take away from here is the motivation and like confidence factor of these patients that I've worked with. A lot of them are breast cancer, or they'll be like a head and neck sort of cancer. And, sometimes you're the first person they're seeing after they got diagnosed. And it can be kind of a daunting experience. And, a lot of media and entertainment today will kind of portray having that cancer diagnosis as the end all be all, and then they come in here and we try and reiterate as much as we can. You have a support here. You have a team of 5 or 6 people, surgeons, physical therapists, speech therapists, occupational, everybody's all working together. It's just kind of going back to using those resources that you have here. Your family needs you, you need you. There's things that you love in this world, and let's get you back to it. Like this isn't the end of it. And I think what's interesting, I guess number 3 is how with some patients, you hear the term all the time, like you beat your cancer, or like she's fighting the cancer right now. And, being outside of the oncology world, it seems like I always just picture that as somebody who's just having enough energy throughout the day just to keep pushing on through the crazy medication, these chemo infusions, but it's not that. It's using these resources that you have, and it's making that extra step. Durley, you're so good at educating patients and making sure they know what they need to do. And it's just step by step, keep building, keep growing. A lot of times it's like a 12-month window where this is where you're going to have to get after it, and you're so good at motivating that. And I'm hoping to kind of take away those tactics, and use it in my future field, whether it be with oncology, whether it be with athletes. I think it's incredible just to kind of see where someone's at, and then show them how to get from A to B,
Awesome. And how about your most painful lesson as a PT, in a PT school, and as well on your 8 weeks here at the clinic?
Most painful lesson. That's a good question. Yeah, I think it's interesting to see. I guess what's been hardest is the difference in patients, right? Is like some who are coming in, 2 weeks after surgery compared to some who are coming later in. But yeah, it's been different as a male figure, especially, I'm 24 years old, I'm married. And it's been interesting I guess it's been the toughest is to portray to the patients, listen, I'm here for you. I want to make this as comfortable as I can for you. And it's crazy just going from physical therapy school to now, I'm helping treating these independent women who just had, maybe a bilateral mastectomy. They have these giant scars here. And then I'm the first person to, lay hands on top of the scar to kind of see where they're at. So I think it's been the toughest just to try to build rapport with those kind of patients and let them know, I'm qualified here. I'm here for you, give me as much feedback as you can, and try to make them feel as comfortable as possible throughout a crazy, crazy start of the journey, and especially getting them ready for the rest of it and letting them know what it's going to be like the next year or so.
Yeah. And I want to tell you, Steven, you've been doing great. I remember on your first day here, I think that was your first patient was a post-mastectomy.
Yeah. Yeah.
First day, and here you go. You were the the scar and you like look at me like, are you sure you want me to do that? And then it's like, here you go, here. And that was first day, here you go.
Yeah, I'll never
So
forget it.
yeah, so that's you've been doing really well. It's great communication. Again, as being in this field and then the breast cancer patients, most of people is very like, at this point, like we just have a patient this morning, like, at this point it's like, well, everybody has been looking at them, may as well. Somebody else is okay, doesn't matter. So most of them are really good. Some of them are no, they don't feel comfortable with a male, being young male student.
Yeah.
But we've been handling that well with that part, you're not here. And then, you just come back and do the other areas that you can be working on. So you've been doing great with that.
Yeah, no, I appreciate that. Yeah, no, it's been great.
How about your most painful lesson as a PTA student?
Just as a student in general and
Yeah,
related to
the school.
here in the clinic, or
Yeah, and school, like for 3 years, like if you say, oh my God, whatever has been like when you started the journey in PTA school.
Yeah, no, it's interesting. I wouldn't consider myself as like, top of the line Harvard or Yale material, but you kind of look around at your class and it's really tough to get into physical therapy school. It's like a really competitive process, and I kind of leaned on the fact that I was, I had a pretty extensive resume. I was really well involved in stuff. Like grades weren't really like at the top of my list, I guess. I was trying to hope to bank on the rest of it while being a college football player, but yeah, it was definitely a wake-up call. And now seeing it, you being a former physical therapy student and everybody else in the clinic, how much time you really have to set aside to be the best you could be. I can imagine, I remember sitting in the cadaver lab, my first anatomy exam, and, thinking I could only have to put in a few hours here and there. And then I hear people sit in the cadaver lab for 8 hours, smelling like formaldehyde for the rest of the day. And I didn't realize that that's what it's going to have to take, so I'm going to have to kind of step off of this pedestal and understand what I need to, make the right grades. But yeah, it's nice to be in an environment where I'm at now, where everybody kind of pushes themselves. I'm like competitive, naturally somewhat competitive, but yeah, it's crazy to see like everybody around me and have to kind of, all right, don't lag behind here, but it's a little bit.
That's great. That's good. And again, I think that that's something that I always say to my students, you're going to be, no matter what school you come from, you're going to be the kind of therapist you want to be based on what you put into it. So always, you being educated to be really knowledgeable about what you need to be fighting for your patients. We have that conversation this morning, right? Never allow anybody to tell you what to do in regarding if you're not agree with it, because it's your license, it's your knowledge, is what here UF everybody has been teaching you, like that's why you have a DPT program. That's why you have to make these decisions, and you need to really sit down with the physicians, and they're no higher than you. They're your team players. So you just really see them as, you're my coworker, and this is my plan, and this is from the PTA standpoint. I know more about body mechanics than you do, even you're the orthopedic surgeon, or you're the breast surgeon, or you're the head and neck surgeon. They're experts in what they do, but we are experts on movement. So we should be able to take that and get them to understand that, it is, it is my say so here, because it's my field. I always say to students, not, a surgeon, you'll never, well, as a therapist, I'm not going to tell them just use, a screw number 3 versus a screw number 4 for your joint replacements, right? Because that's their field. So don't tell me what to do in regarding do this protocol just because it's not what I went to school for, right? I should be able to know exactly how a tissue heal for me to know what exactly I'm going to do movement-wise to try to improve that. So it's important to keep that in mind. Don't ever let people just kind of like, no, you do that because you're under my clinic, and that's what we do here. So you always need to be like, no, what are you doing this for? And always fight for your patients. I think you have seen that here, like, how well we go along with the physicians, and we are really on the same plane, right? The same respect, part of the team. So that what should be no matter what environment you are at.
Right. No, yeah, I totally agree.
Yes. So how about, is anything that you have that will be a value for our audience that you want to add?
Yeah, I was kind of thinking of two things whenever you ask that. One, I think of windows, and one, I think of the team, right? So window wise, I try to reiterate a lot to patients. I think I said it, or maybe I heard you say it the first couple of weeks I was here with you. And, for patients going through this, it's a crazy journey, right? You get diagnosed with cancer, you feel like your world gets turned upside down. But if you take a step back and kind of look at it as like a global perspective, right? It seems like this is the one like window of opportunity for you just to have to get after it. This is it. And then if you incorporate the team aspect as well, you have, your surgeon, your medical oncologist, if you're going through radiology, your rad oncologist, you have your physical therapist, you have this team of people who are all committing this time to you. It's like if you can just keep chipping away month by month and you turn around and look and see where you're at then 9 months ago and you look where you're at now, it's such a crazy difference. And I think patients sometimes can get, it seems like from my perspective, from what I've seen here working with cancer patients, 8, 9 hours a day, it seems like a lot of times patients can kind of get stuck from where they're at. They look at where they're at, they're looking at how their body has changed, how their weight has changed, they look different in the mirror. But I think a lot of times, especially if you've been chipping away, if you've been taking those next steps, it's really important to kind of turn around and see where you're at, right?
Mhm.
Take those 10 seconds, take that little glimpse of time to look and see, okay, that's where I'm at. That's the progress I've made. And then just keep trucking forward. And at the
Yeah.
end of the day, you're never alone in this, especially it's just unbelievable. Just from what I've learned here in the last 2 months, working in all oncology, how much has changed,
Mhm.
like research wise. And we're going through somewhat of a medical evolution here or revolution.
Yep.
Yeah. And I mean, I see, me and you see patients occasionally who had a surgery back in the 90s or early 2000s, and they come in for the first time. Maybe they had another reoccurrence and they come back in and they're like, this is just so different. And
Yep.
I think it's important for patients to take advantage of that.
Yep, absolutely. Yes. And I think and everything, right? Not just oncology, but if you go back into, total joints, we used to take everything out. Right now it's like,
Right.
do we really need to? We just do part of the joint. So same thing with breast, right? Back then it used to be like the whole breast comes out, the whole lymph nodes come out. No anymore. Now the surgeons are so more conscious, like really is necessarily to do all this morbidity to a patient if that's not going to change their survival,
Yeah.
uh, time or the prognosis for another recurrence. Same thing with chemotherapy. We used to give everybody chemo no matter what. Now it's like we have these oncotypes to tell us how is you respond to chemo. Do you really need it or not? So
Mhm.
we just really becoming so much better looking at the whole picture and quality life to see it's
Yeah.
necessarily to do this because we may do all this and that's great. We took care of the cancer, but we leaving them with all these other issues that they don't need to be there. So
Mhm.
yeah, you're
Yeah.
right. So that has been a great evolution. And I've been doing this for 14, 15 years. And it's like, as you see, when we talk about in tumor board about new trials, it's like a non-stop. It's like I lost track of it. Like every week something happened, every month something is new coming, which is great. So that's really exciting to be as well in a research institution when you get to see that. So it's fun.
Yeah. No, I agree.
How about any books that you would recommend to your audience?
Well, that's a good question. Any books? Um, yeah, I think I actually had a conversation with one of our associates here today. Especially, I'm really heavily involved in the strength and conditioning community, which I think every patient kind of benefit from.
Yeah,
And a lot
absolutely.
of times, I presented yesterday to our crew, and a lot of it covered, the horrors sometime of Google. Whenever a patient can become their own researcher and just type into that Google box, and the recommendations for resistance training, which a lot of our patients will go through to build skeletal muscle mass. The recommendations can kind of be off the wall and not be the best. But I don't know so much a book, but Andy Galpin, he works over at Cal State Fullerton, I believe, over on the West Coast. But Andy Galpin with a G, he is an unbelievable researcher in that field, and he brings it down to a level where regular everyday people who aren't involved in research can kind of understand what he's been coming up with. But yeah, Andy Galpin's a great guy, and he actually just came out with a book where it has a little bit of physical therapy involved in it as well. But that's a good resource, I think, for patients.
Okay, perfect. How about podcast?
Podcast, yeah. I think what's fun, people may laugh because I know it's sometimes like a joke if I have the boyfriend that's an Andrew Huberman boyfriend, but Andrew Huberman, he's a scientist out of Stanford, California, but he comes out, he has the Andrew Huberman lab, and he's all about well-being, how to better yourself, the proper, and it's all research based. He cites articles the whole time, so it's not just a bunch of theories. It's the real deal. But he's a really cool resource, and it's the same thing. He brings it down to a level where people can kind of understand, and it's somewhat consumable, But yeah, a lot of cool info with Andrew Huberman.
Okay, nice, excellent. Will be one more question that you will wish I'll ask you, and will you responded, or how would you have answered it?
You want me to say it again one more time?
One more question that you wish I will have asked you, and
Okay,
how,
yeah.
and that you will be have answered it.
That's a great question.
Down.
Okay, yeah. One more question. Let's see. I guess what's the best way to reach your socials and the content you're putting out there? You can click on this Spotify, right? This is my answer.
That's
You can
very
click on
good.
this Spotify link. I think your Instagram will be linked on there. You share a lot of fun
Yes.
videos on there on how to better yourself. Yeah, that's I think you're a great resource.
Okay,
Good
perfect. Thank
question.
you for that. Yes, and I will actually, that was another thing, like how can people get a hold of you? And then I will put that as well on the description of the podcast and how they can contact you, contact me. So what would be the best way for them to reach out to you?
Yeah, I think my Instagram is widely accessible. It's chowdown09. My last name's Witchoskey, so they called me Chow all throughout growing up. But chowdown09 on Instagram. It's a good way to reach me.
Okay, perfect. And like I said, I will put it that on the description. But Steven, that was super fun. Thank you for doing this with me. I know I've been like asking you, and you're like, not too sure. Let me get you with somebody else. But look at that. I think that is nice to have that perspective. And like I say, I think I want you to be part of this, because it's, again, you come in with a completely different background with sports, and then you're here in an oncology world where, I always say to my students, my role, or what I would love to do, is to convert all of you guys in oncology therapists. So and I spread out the wings out there everywhere, because it's a huge need for it. And it's not that many centers who had a great rehabilitation program focused just in oncology. So that's kind of my goal, is to kind of put that little seed on you guys' head and hopefully spread the wings. But I think that you will bring a lot of value for what you learn here for your future journey, even if it's not in oncology, if it's in the sports world. But I think there will be a really, change a lot of your vision in, like, how to be a better therapist in the future.
Right. Yeah, this has been an unbelievable experience. It's totally changed my perspective, and I'm hoping it kind of causes a ripple wave throughout my community as much as I can reach out. And then and I'm glad you're doing this podcast. I'm glad you're being so informative about it. It's crazy how many episodes you've already recorded. We'll keep going and going, and I hope this thing keeps growing. I think patients are really benefiting from it.
Thank you so much, Steven, and you have a great day.
You got it. Bye, everybody.
Bye.